that would permanently alter the minds of over 4,000 human beings. This is the terrifying true story of the lobotomobile and the man who turned an ice pick into America's favorite psychological cure. In 1946, a prominent American doctor walked into his kitchen, opened a drawer, and pulled out a standard 3-inch metal ice pick. He didn't need it for a block of ice. He needed it for a patient waiting in his clinic. His name was Dr. Walter Freeman. He wasn't a trained surgeon, yet over the next 2 decades, this man would travel across the United States in a custom station wagon, pulling up to states' asylums like a traveling salesman. Inside that car was a medical kit that would permanently alter the minds of over 4,000 human beings. This is the terrifying true story of the lobotomobile and the man who turned an ice pick into America's favorite psychological cure. To understand how a man with an ice pick became a medical celebrity, we have to look at the sheer desperation of 1940s psychiatry. State mental institutions were completely overwhelmed. In the wake of World War II, soldiers were returning with severe trauma, and asylum populations skyrocketed. Facilities built for hundreds were packing in thousands. The air inside these wards was thick with despair, screams, and the heavy sedation of primitive drugs. Psychiatrists had no real answers. They tried electroshock therapy, insulin-induced comas, and hydrotherapy, locking patients in an ice-cold baths for hours. Nothing worked. The hospitals were essentially human warehouses. Enters Dr. Walter Freeman. He was a neurologist who wanted to cure the incurable. He became obsessed with an experimental European procedure called a lobotomy, which severed the pathways to the brain's frontal lobe to calm severely psychotic patients. But the original version required a full operating room, drilling holes directly into the patient's skull, and hours of meticulous surgery. It was slow, it was expensive, and Freeman was a man in a hurry. He wanted a cure that could be done in minutes, anywhere, by anyone. Freeman's breakthrough was as simple as it was horrifying. He realized he didn't need to drill through the thick bone of the skull. The thinnest layer of bone protecting the brain sits right behind the eye socket. He called his new method the transorbital lobotomy, but it became known globally by a much simpler name: ice pick lobotomy. Here is how Dr. Freeman would perform a miracle in under 10 minutes. First, there was no anesthesia. Freeman would shock the patient with 3 consecutive bursts of electroconvulsive therapy, rendering them temporarily unconscious. Next, he would lift the patient's eyelid. He took a custom-made steel instrument, initially a literal kitchen ice pick, and slid it carefully between the eyeball and the upper eyelid. With a few gentle taps from a rubber mallet, he would drive the steel pin through the thin bone of the eye socket, pushing it roughly 3 inches deep into the frontal lobe of the brain. Once the steel was inside, Freeman would swing the handle back and forth, cutting the delicate white matter of the brain, severing the connections that governed emotion, anxiety, and personality. He would pull the steel out, move to the other eye, and repeat the process. Within 10 minutes, the patient would wake up. They had no stitches. They had no skull fractures. Usually, they had just 2 massive black eyes and a completely rewritten mind. The medical establishment was horrified. Prominent neurosurgeons called the procedure crude, blind, and butchery. But the desperate directors of overcrowded state asylums saw it as a godsend. A lobotomized patient didn't scream, didn't fight, and didn't require expensive around-the-clock care. They became docile, easy to manage, sensing his moment. Freeman went mobile. He packed his electroshock machine, his mallets, and his gold-plated ice picks into his personal station wagon. The press quickly gave it a chilling nickname, the lobotomobile. Freeman tore across the American heartland. Visiting dozens of hospitals in 23 states, he turned his surgeries into a traveling roadshow. He would invite local reporters, politicians, and doctors to watch him work. He became a showman. He started timing himself with a stopwatch, trying to build his personal record for the fastest lobotomy. To shock his audience, he would sometimes perform the procedure two-handed, driving ice picks into both of the patient's eye sockets simultaneously. He didn't wear surgical gloves. He didn't wear a mask. He performed these brain operations in standard hotel rooms and chaotic asylum wards. To Freeman, sterilization was a waste of valuable time. For a while, Freeman was hailed as a savior. He was featured in Life magazine, but behind the sensational headlines, the collateral damage of the lobotomobile was devastating. Freeman claimed a high success rate, but his definition of success was deeply distorted. If a violently anxious patient woke up and could no longer speak, feed themselves, or control their bladder, Freeman considered them cured because they were no longer violent. Families quickly realized the horrifying truth. The ice pick didn't just take away the madness, it took away the soul. Patients were left as empty shells, childlike, listless, and stripped of their memories and creativity. Perhaps his most famous tragedy was Rosemary Kennedy, the sister of the future President John F. Kennedy. In 1941, at just 23 years old, her father brought her to Freeman to cure her mild mood swings. The lobotomy went horribly wrong. Rosemary was left with the mental capacity of a 2-year-old child, unable to speak coherently or walk properly for the rest of her life. Yet, Freeman kept thriving. He even began operating on children, including a 12-year-old boy named Howard Dilly, whose stepmother wanted him changed because he was a defiant. Howard survived, spending decades trying to understand what the man with the ice pick had stolen from his brain. The wheels finally came off the lobotomobile in mid-1950s. A new wave of psychiatric drugs, specifically an antipsychotic called Thorazine, entered the market. Suddenly, hospitals could calm patients with a simple pill. The brutal era of physical brain slashing was obsolete. Freeman, however, refused to stop. He spent his final years driving his station wagon across the country, desperately tracking down his old patients to prove his life's work wasn't a mistake. In 1967, he performed his final transorbital lobotomy on a woman named Helen Mortison. It was her third lobotomy by Freeman. She died of a brain hemorrhage on the operating table. The hospital stripped Freeman of his surgical privileges, and his license was effectively revoked. He spent the rest of his life in obscurity, dying in 1972, still convinced he had given the world a miracle. Today, the transorbital lobotomy is remembered as one of the darkest chapters in medical history. A time when American medicine let a man with a station wagon and a kitchen tool rewrite the minds of the vulnerable, leaving thousands trapped in a silence they never ask for.